Unless, George, you have some concluding remarks. Uh, I'm George Isham, co-chair of the Roundtable with Sanne Magnan. And I was sort of asked a little earlier if I wanted to make my own reflections earlier in the process, and I'm not so sure that I have a sense of what I'm taking away from this. There was so much of a rich conversation today. I can just sort of pick out a few things. One, George Flores started with a conversation about isms and power. That first part of the conversation, and I think there's a reason, and I've heard George talk about this before, but I've thought about it a little differently in the context of recent electoral events, actually, at the national level, and I'm wondering how that works at community levels. And I don't have an answer to that, but there's a lot of very important things that you've said that I need to reflect upon. So I'll leave my comment with that. I think I'm very grateful to once again hear that perspective. Martha's question, really great question. What is the role of health relative to other framing? And I think about education, economics, and race, actually, and wonder about those relationships and how it should be framed versus wellness as well. Another sort of something to ponder in terms of reaction. I understand, at least in my own news feed, that life expectancy in the country has fallen, and I don't know that we've talked about that yet in this day of conversation. But of course, that outcome is central to the purpose of the Roundtable. If we define our outcomes as quality of life and length of that life. And it seems that, at least in the several news accounts that I've managed to glance at without looking at the sources, that there's a lot of speculation about why that's occurring, and a lot for us to think about. It's not only the length of life, but it's the distribution of disparity across the population and at multiple levels. In the conversations that Soma and I have had, both here and elsewhere, it's thinking about the complexity of the different levels at which these various questions arise, and trying to get clear about what messages we should be thinking about in terms of that complexity so that we can convey messages to people that want to take action, whether they're at communities or in organizations or in local, state, or federal governments. And it seems like the spectrum of opportunities is shifting with the shift in electoral politics that has occurred, because we have different political philosophies that may be governing activity at some levels, and yet we have this just tremendous example today of activism at a very local level, inspiring leadership that seems to be irrespective of those kinds of things going on. That's something to tap into. It's a strength that we need to admire and be part of and be inspired by, quite frankly. So I really am impressed with that. Sheldon, your language slide of the mission statement, and then having us look into each other's eyes and contemplate what we didn't like about, very, very powerful. Not only as an exercise of interpersonal sort of driving a message home about framing, but then when we think about that framing in other contexts, in terms of framing in community communications, institutional communications, state or political level dialogues, very, very powerful. Thank you so much for bringing that to this conversation. I was personally very moved by that, as I suspect many others in the room were as well. The measurement issue, and my friend Matt can't leave alone the standards versus the the democracy of standards, at the level, and I think it's a both and, you know, quite frankly. As I think about the example of, I'll say something about my home state of Minnesota. Strong commitment to measuring things by national standards, but also a strong commitment to measuring things by Minnesota standards, and a strong commitment to measuring things by health partner standards, not in conflict with one another, but in a both and kind of commitment to measurement as a tool to enable success in outcome in achieving performance. I'll just make that comment in terms of measurement. And you're right, but others are right too, in my opinion. I think I'll leave my comments alone at that point. Much to think about, much to think about. I know I want to myself download the slides, and you can do the same on the website. There are some of the discussions that I actually may want to look, view again, and we'll have the video on the website, right? Right. So you can go and link to that. There may be some of us that are slower processors than others who want to do a little reflection. I'm with you. I may want to do that. So remind us of the website again. It's NASEM. NAS? Okay. Say it once again. Okay. nas.edu/pophealthrt. Okay. And I encourage those of you on the web, as well as those of us here in person, to, one, look at the materials that will be available there to, if you're a slower processor like I am, to encourage your further thinking. Any other comments before I make a couple of additional concluding comments? Anybody else want to say anything? Sanne, my partner in crime here, my co-chair.
So I just had a reflection about a paper that a number of us wrote that are in this room probably about 8 or 9 years ago. And in it, we proposed this vision of a community reinforcing loop in which if healthcare would actually save money, that some of that money could be reinvested into communities to make them healthier. So to hear, and so we actually submitted it to a number of esteemed journals, this whole concept of this community reinforcing loop and accountable health communities, et cetera. And one after one, these journals rejected that concept. And in fact, one physician said, why would anyone ever give up their margin to put it back into community? So to actually hear that Algoma and Belen are actually doing that vision that we had years ago is unbelievable almost, you know. It's and so it just reminded me about the importance of vision and of having an idea that maybe his time is not quite right, and yet you hold on to that idea and you keep working it and you keep thinking about it and you keep promoting it. So I just wanted to end here with the Roundtable vision, that a strong, healthful, and productive society which cultivates human capital and equal opportunity. That's the vision of the Roundtable and why we gather and why we do what we do. And yes, there's a lot of conflict in our country right now, but I believe and have a vision that resolution is possible. And I think what we heard today with all of these communities, in which a common theme was deep, deep listening. And I think in the midst of any conflict, I heard someone say this week that in the midst of any conflict is a desire to be heard. The desire to be heard. And that's the first step towards any resolution. And that resolution is possible if we can believe it. And with that kind of vision that we have of a strong, healthful, and productive society which cultivates human capital and equal opportunity, I think it's a good place to hold out.
Thank you, Sanne. Thank you very much. I looked at our emeritus co-chair, David Kindig, and he doesn't want to make a comment, but I'll say that I'm continuously inspired by David, and thank you, David, for the work you do, such important work you do behind the scenes. So we're at the end of the day. We're actually at our end, right at our end time. George Flores, you've done a terrific job of leading a very capable planning committee. Andy DiBiase, Mary Lou Gakey, David Kindig, Marcy Parkhurst, Soma Stout, Jamila Watson-Thompson. So again, terrific planning committee. Thank them again. In my own comments, I singled out Sheldon, but you know, that was unfair because I thought those of you who came and prepared talks and comments did an outstanding job. I mean, this was a tremendous group. So thank you for doing that, and thank you for those of you who are guests that have come and who live in this area and who don't live in this area but have come to attend this conversation. We really appreciate that, and we really appreciate the people that have joined on the web and who've hung in there through the day. Roundtable members, this is an ongoing conversation that the Roundtable is having on different aspects of achieving the vision that Sanne has laid out. And I think this particular episode has contributed to that conversation. None of this would be possible without the capable abilities of the National Academy staff under the capable leadership of Alina Bachu. That's Colin Fink, Darla Thompson, and Amy Geller. So thank you to them. And at this point, I have nothing else to say. And if you have nothing else to say, we will actually adjourn. So thank you so much for attending.